Assalamu alaikum, ladies and gentlemen. I am Muhammad Izhan Sadiq, a final year DVM student studying at University of Veterinary and Animal Sciences, Lahore. Registration number 2021 DVM Evening 042. Today I am presenting a clinical case of ovarian remnant syndrome in a queen. This case is important because it highlights a major surgical complication after ovariohysterectomy and shows the diagnostic challenges and clinical consequences that can develop when functional ovarian tissue remains behind. Ovarian remnant syndrome, or ORS. It occurs when active ovarian tissue persists after a space surgery. This tissue continues to produce estrogen and sometimes progesterone, leading to recurrence of heat signs, behavioral estrus, and in some cases leading to stump pyometra. ORS is well recognized in dogs, but in queens it is less commonly reported, which makes this case especially instructive. So in this case, the patient was a 2-year-old female cat, which was spayed in May 2016. And around 8 months after the surgery, the owner noticed signs of estrus, which are vocalization, lordosis, posture, vulvar swelling, and a seromucinous discharge. These episodes occurred twice within 1 month, raising suspicion immediately for ovarian remnant syndrome. On clinical examination, the cat showed classical estrus behavior, lordosis, rolling, attraction to male cats, vulvar swelling, and mucoid discharge. And a few days later, the cat developed abdominal pain, vomiting, pica, constipation, kyphosis, and overall weakness. These systemic signs suggested complication, especially the possibility of uterine stump infection under the hormonal influence. So first, diagnostics were considered. Vaginal cytology demonstrated a high proportion of conified superficial cells, which confirmed the estrogen exposure. And CBC later on in the clinical examination and the lab examination showed leukocytosis and lymphocytosis, which aligned with an inflammatory process such as stump pyometra. The radiographs, they ruled out a foreign body, and ultrasonography was initially inconclusive, which is common because small ovarian remnant syndrome may not be visualized, especially if the tissue is not hormonally enlarged, because on recurrent estrus plus blood work changes, ORS becomes the primary diagnosis. So how the doctor or the attending physician took this case, it was presented to them with the clinical signs that I explained. And the animal was healthy, it was not showing any signs of systemic illness, so they had a tentative diagnosis of ORS, and they gave the animal medroxyprogesterone, which is defined as by the author as a mistake, and it complicated the diagnosis later on. It also led to the development of stump pyometra. Now, because imaging was inconclusive, so the diagnosis was based on the clinical signs, and the clinical signs of the cats were worsening. So the clinicians, they decided to proceed with the exploratory laparotomy, which could be the basis of the diagnosis later on. Now, this is considered as the gold standard for diagnosis when ovarian remnant syndrome is suspected, especially in queens where remnants are small and difficult to detect. When the surgery was performed, during surgery, a functional ovarian remnant was found on the left side. This is notable because many reported cases describe a right side predominance, but this case confirms that remnants can occur on either of the sides. The ovarian tissue was carefully dissected and it was removed, and the uterine stump was inspected due to suspected stump pyometra. Now, the definitive treatment was surgical excision of the ORS and postoperative management with antibiotics, analgesics, and supportive therapy. As I explained earlier, this case was novel because first, it was reported in a queen. Second, on the surgical excision, it was reported on a left side. And normally, most of the cases are of the right side, because on the right side, it is more you need a more cranial approach to excise all of the ORS during the space surgery. So third, the thing is the imaging, both ultrasound and radiography, was negative. Didn't show the diagnostic if didn't show that any diagnosis of the ORS, but on the exploratory laparotomy they found the ovarian tissue. So the key takeaways from this case are that the persistent or recurrent T-stress after space should always raise suspicion of ovarian remnant syndrome. It should be your top priority to diagnose. The vaginal cytology is simple but is extremely helpful and should always be done. Imaging may be inconclusive, especially if the ovary is small, and progestins like medroxyprogesterones should be avoided as they worsen and mask the condition. So exploratory laparotomy is often necessary and is the only definitive diagnostic and therapeutic approach. In conclusion, this case highlights an important surgical complication in cats, and this also gives us a whole new approach uh, on how to treat a classical case of ORS. Thank you. Drop if you have any questions in the comments.